So let's get into it, Dr. JP. What is fibromyalgia?
And that's a loaded question, because again, fibromyalgia is a term that's been thrown around lately for pretty much anything, and it's really hard to even describe because there's no real diagnosis for it. And fibromyalgia is characterized by chronic, widespread pain throughout the body, and they haven't really found a cause for it, even though today we're going to actually explain some of our theories and what causes it. But it was described way back about 150 years ago, but the terms were different. They would call them myofibrosis, they would call it myofascial pain syndrome, muscular rheumatoid. But again, the diagnosis became really official back in the 1990s, and I usually tell my patients that's actually when there was a drug that was invented for it, where we actually became recognized, or they became recognized as fibromyalgia, because there was a drug created for it.
And you know, one of the interesting things about it is that fibromyalgia, just like migraine headaches, definitely affects women way more than it affects men. Yeah. And you know, fibromyalgia isn't something that really just happens on its own. When I see patients in our office with fibromyalgia, they usually have other things going on, like migraine headaches. They also have things like TMJ, tension headaches, sciatica, neuropathy. So this is really a bundle of diseases wrapped up into one that they're just trying to put a label on.
And that's why they've had difficulty treating fibromyalgia, because it comes up with so many symptoms when they go to see a doctor, and they have things that you mentioned, like fatigue, sleep disturbance, migraine, tension, irritable bowel, TMJ, you name it. So they are focusing on, of course, curing these things. So many of the patients get a cocktail of medication to treat different things, and in the long run they make them more miserable and more irritable and become depressed, because they're not actually focusing on the problem itself. They're focusing on all the symptoms that come from having fibromyalgia.
And you know what the really frustrating thing about it, at least from the things that I get from my patients, is that a lot of these patients really feel like they're not being heard. They feel like that everyone around them thinks that they're faking their disease, that they're not really in as much pain as they say that they are, that they're acting out. And a lot of doctors have kind of fallen into this trap too, because one of the main things that people are doing to treat these patients is to give them an antidepressant.
That's it.
Or to send them to a psychologist or psychiatrist, because obviously the disease is just in their head.
Right. And again, what you say is so common to many people with fibromyalgia, because they really become frustrated, because if you're constantly in pain and different things going on, and simple things like a touch can cause excruciating pain, and all the tests that they're running doesn't show anything, obviously now you get onto antipsychotic drugs that's actually going to make you worse. And I have a lot of patients where they literally start giving up on life, because they start thinking that maybe it's in my head, maybe I'm not really in that much pain. Maybe, you know, they're right, but the problem is it's so widespread as far as the pain and the symptoms that it's really hard for them to really pinpoint what's going on.
And just thinking about how this might impact someone's life is just think about if you're going to just, you know, give your wife a massage while you're just sitting on the couch hanging out in bed, and all of a sudden she has to throw your hands off because you're just like, you're hurting her.
Yeah, and then that's the thing, and that's one of the characterization of fibromyalgia. Little things like you poke somebody on their shoulder, on their arm, that, you know, if I poke hard enough, it may hurt, it may last a few minutes, or in some cases an hour. To somebody in fibromyalgia, that little thing is long lasting. It's almost like you stab them with a knife. And those are some of the things that kind of pinpoint when you have fibromyalgia. Little things is the over exaggeration of those nerves ending that carry pain to the brain.
Well, that's a good transition, because now we got to talk about, you know, what inside the body is happening to make this pain so real for these fibromyalgia patients.
And again, pretty much every research study that's been done show that really what's causing fibromyalgia is the miscommunication or misfiring of the nerve ending as it goes to the brain. So as for you and I, normally if you do this, the brain sends signal up to the thalamus and integrate to pain and it goes away. To these people, that pathway is not working properly or is oversensitive, which causing some of these things that creates the pain with fibromyalgia.
One of the things that I remember reading about and learning about in chiropractic school is just this concept of central sensitization, where the central nervous system is just primed to feel pain, because only about 10% of our nerve fibers are really capable of sensing pain. But for whatever reason, these nerve fibers are getting into the brain easily and just overwhelming someone's body with a pain signal. So when I see patients, I like to compare it to like a thermostat, where normally if you keep your thermostat in the house at around 75 degrees before the air comes on, so if the air is like a pain signal, then when someone has fibromyalgia, it's like having their thermostat set down to 50, so their air conditioning is constantly going off and creating these pain signals for them.
Yeah, and then this quote from no relation, Dr. Chan, it's an MD. It's fibromyalgia is really an oversensitive nervous system generating a false alarm and from ordinary stimuli. So for you and I, it would be an ordinary touch, but for them, it's just an over-exaggeration of it. And physiologists now recognize that nerves and muscles can generate abnormal impulse, and the technical term for this supersensitivity is fibromyalgia. And again, every single thing that I've read about fibromyalgia has something going on with the nervous system, ironically, which is what we do in our office every day.
Yeah, we'll get into that in a little bit, but let's talk about how does someone come down with a diagnosis of fibromyalgia? Say they go into a doctor's office, how do they know that this is actually going on?
And again, just like I said, it's so misdiagnosed because fibromyalgia present with so many different symptoms. We talked about migraine one time, and migraine can be one of them, TMJ. There's so many different symptoms that typically fibromyalgia is a diagnosis of exclusion. We've tried everything else, and nothing else worked. But there's a criteria nowadays that when you have pain in each of the 4 quadrants of the body, and when we talk about the 4 quadrants, we talk about from the back, we're talking about the back of the shoulder, then we go down to the tip under the scapula, and then you go down to the hip and buttocks area. And from the front, you're looking at the neck region, biceps, and knee. So when you have pain or sensitivity within those 4 quadrants, at least 4 quadrants for 3 months, or at least 11 of the 18 trigger points for 3 months, then you come up with a diagnosis of fibromyalgia.
That's really funny, and it might stir up some controversy here, but that is just a laughable way to diagnose someone, is by pushing on a couple of trigger points, and then if enough of them go off, then they have fibromyalgia. I mean, you can press on my shoulders right now hard enough to get at least 5 or 6 of them to actually sting pretty good.
And I didn't say it was the way to diagnose it, but that's it. That's pretty much there's 2 criteria to diagnosing fibromyalgia. And of course, like I said, it's really a diagnosis of exclusion. They've tried everything else, and patients still complaining. And like I said, they never actually recognized fibromyalgia until there was a drug for it, and we'll talk about that as well. But again, it is real. I see tons of patients in my office for that, and some of the things that we do actually get them better.
For sure. Well, we're going to take a quick commercial break, and we're going to talk about treatment options for fibromyalgia, including what the NUCA procedure can do for these patients with fibromyalgia. So we'll take that quick break. Make sure you call in and take advantage of our $100 gift certificate at Keystone Chiropractic in Wellington and the Upper Cervical Institute of Florida.
When was the last time you had your atlas checked? When your head and neck shift out of place, it can actually affect your whole body. Do you suffer from migraines, TMJ, dizziness, or chronic back and neck pain? If so, you may have an atlas problem, and you need a NUCA chiropractor. NUCA allows for a gentle and precise correction of your spine without any popping, twisting, or cracking associated with conventional manipulations. Call Keystone Chiropractic at 561-247-0044 and schedule a free consultation. Dr. Chung is one of approximately 300 doctors in the world trained in the NUCA protocol of spinal correction. Stop suffering. When your doctors can't determine the problem, you need to contact Keystone Chiropractic. We won't ask you to believe in chiropractic or commit to a lifetime of treatment. What we will do is show you what normal is, and we'll tell you how to get there again. We'll show you using precision technology that your spine has changed for the better, even after one correction. Then we'll show you the path for keeping it that way. If you are tired of constantly patching the problem and you're looking for a long-term solution that you can both feel and see for yourself, then a NUCA office is the right place for you. Once the foundation has been fixed, then we'll teach you how to keep it that way through customized recommendations designed for your spine so that the problem doesn't come back. What do you have to lose? Call today to schedule your complimentary consultation. If you call during the hour, we'll give you a $100 gift certificate to use towards your first visit. No questions asked. No commitments, just a conversation to see if we can help. 2 convenient locations in Boca Raton and West Palm Beach. Call Keystone Chiropractic today and end your days of suffering with chronic pain. Go to our website at www.keystonechiropractic.com or call us at 561-247-0044.
Are you searching for answers to your health problems? Are you looking for an alternative to harmful drugs and dangerous surgery? Have you tried everything else and figured this is just something you're going to have to live with for the rest of your life? At Upper Cervical Institute of Florida, we provide you with a safe, effective, and natural approach to restoring your health and regaining your life. Dr. Jean-Pierre will find the cause instead of masking the symptoms. Dr. Jean-Pierre utilizes the most specific techniques in detecting and correcting the vertebral subluxation. At Upper Cervical Institute of Florida, we pride ourselves in providing you with the highest standards of healthcare for you and your entire family. The procedure is gentle, effective, and affordable for everyone. Call now to schedule your free consultation. 561-409-3594. That's 561-409-6594. Or visit our website at www.uci-fl.com.
Welcome back to the Heal Yourself radio show. This is Dr. Jonathan Chung on the air with Dr. Greg Jean-Pierre. Today we're talking about chronic pain and fibromyalgia. So now that we have a little bit of an understanding of what fibromyalgia is, let's talk about what people are doing to actually treat this problem. So I know you had pulled up a little bit of information for us, Dr. JP.
Yeah, and again, just like we talked about, the problem with fibromyalgia is there is no tests or there's nothing to actually figure out what it is. So it's really hard to even figure out whether you have fibromyalgia or not. But some of the things that they're doing as far as treatment of fibromyalgia, like I said, is pretty much treating the symptoms. Depending on what you are experiencing, you have headaches, they have drugs for that. You have this, you have drugs for that, until they realize that you have fibromyalgia. And there's really nothing out there as far as medical treatment for fibromyalgia other than symptom reliefs. Except, like I said, back in the 90s, there was one drug that it's the only drug that was invented and that's approved by the FDA as far as supposedly effective for fibromyalgia, and that's Lyrica. I mean, we all seen those commercials with Lyrica, but I took the time to really take a look at what are the side effects, because a lot of time we hear this drug and we see everybody on those commercials with green grass and they're happy, but some of the symptoms that come from the drug itself, it's so crazy that I don't know why anybody would take it. And pretty much every patient that any patient I've talked to that had this drug don't experience any relief in symptoms. But again, the side effects of Lyrica: dizziness, sleeplessness, dry mouth, sleeping, swelling of the hands and feet, blurred vision, weight gain, trouble concentrating and feeling high, other serious allergic reactions, swelling of the face, mouth, lips, gums, I mean, you name it. And then in really fine print, and just like most drugs, it may cause suicidal thoughts. So these changes, and those people, remember, they're already psychologically drained, so you give them a drug that can cause suicidal thoughts and changes, it make them depressed, anxiety. So the same drug that you're giving them to combat what they already have can cause the same things. And if you ever listen to those commercials, those are the things that they talk about really, really fast, so you don't hear it. So again, it's been proven ineffective that drugs, the outside in approach, really doesn't work for anything. So no wonder a lot of this patient that's suffering from fibromyalgia, they end up having unnecessary surgeries, unnecessary treatments, because none of these things are working, because they're focusing on the symptoms rather than focusing on the problem itself.
And one of the really scary things to me is that a lot of these patients are also given antidepressants as the first line of treatment too, which kind of just serves to justify the fact that these patients are just experiencing something that's psychological, or just in their head. So when people are taking Lyrica and these antidepressants, you're really messing with the neurotransmitters of the brain, so you're really, taking some leaps to mess with someone's brain chemistry to address something where they don't really know what the cause of the problem is.
Right. And I want to be really clear. When we're talking about all these drugs, we're not against medication. We're not against that. What we are against is that being the first choice of treatment, because again, unless you get to the root cause of the problem, you're never going to solve the problem. Fixing the symptoms is not going to fix anything. Again, people with fibromyalgia, it's interesting enough, a lot of them become depressed. A lot of them are on anti-psychotic drug, because how would you feel if nobody's getting you and you're having all these pains, all these symptoms, all these weirdness, and after a while they can't find the problem? So obviously the next step is medication. And again, as even with me, when I tell my story with migraine, that was one of the course of treatment after a while that was given to me, because there was nothing on x-ray or scan that showed that I had migraines.
So let's talk about some of the things that we do know that are effective, that people don't have to run to a doctor's office in order to take care of it. I know that when people with fibromyalgia start to exercise regularly, their ability to control and manage their pain definitely decreases significantly.
And one of the things that I read, before we even get to that, you got to understand, why do you get fibromyalgia in the first place, which is a good question, because from research, pretty much everybody that has fibromyalgia, surprisingly enough, have had some kind of trauma, injury, accidents, fall, something that happened previously before they even had that, and then maybe a year or two later they start developing those symptoms, creating what we call fibromyalgia. So it's really getting to the root cause of the problem, figuring out what initially started the problem to begin with, instead of fixing the symptoms. Okay,
I think that brings up a good point, is that I think one of the reasons that exercise can provide some temporary relief for fibromyalgia is because these people that have had some kind of traumatic history, whether it was a car accident, whether it was a fall, there's something in their body that's locked. And that brings us to what we do, which is, of course, the atlas subluxation, is when that neck gets locked, especially from things that, things like whiplash, then people are going to have their brainstem and their nervous system just get fried with these chronic pain signals.
And again, when you're talking about the nervous system accident, let me read a couple of these things to you. And these are all quotes from different medical doctors that's acknowledging what fibromyalgia is, what's causing it. The cause of fibromyalgia must involve one or more abnormalities by which the central nervous system is actually picking up pain signals differently. Fibromyalgia appears to result from a central nervous system derangement. The peripheral tissues and tender points are secondary phenomena, and it's an interpretive defect of the central nervous system may be responsible abnormal perception of pain in the absence of recognizable tissue injury. And these are all by different researchers that are classifying what fibromyalgia is, but you can see the common thread in everything is the central nervous system. And how does it get that way? Trauma, injury, fall, something happened. And a lot of time it can also be chemical induced trauma that can cause the nervous system not to function properly, which is a perfect segue to what we do and how we are able to be so successful at treating fibromyalgia.
Absolutely right. So what happens is when that atlas, that top vertebra in your neck, starts to shift and slide out of place, then not only are you interfering with those nerves at the top of the neck and of course the brainstem, but you're also affecting the way that blood flows in and out of the nervous system. So if you're not getting enough blood to your brainstem, then your brainstem's going to start to get more sensitive to pain and start firing when it's not supposed to. You're also going to get scar tissue that starts to build up, which prevent proper movement of your atlas underneath your skull.
Yeah, and at the beginning of the show we talk about all healing is self-healing, and I find that to be profound, because again, the body, as we've stated many times, the self-healing, self-regulating, self-adapting mechanism. The body is completely capable of healing itself. So why do we get fibromyalgia, and why are we unable to actually get rid of it? Is because of trauma, something shifts. When you talk about the atlas, when you talk about interference through the nervous system, by clearing that interference through the nuclear work, we are able to restore the body's normal ability to heal itself, and the body starts self-healing. Again, the outside-in approach is ineffective and has been proven over and over in literature. So the body is able to heal itself by just simply removing the interference.
And I think one of the biggest things to remember is that because people with fibromyalgia are so sensitive to touch and so sensitive to pain, and a lot of times getting a traditional massage or getting a traditional chiropractic adjustment, where those could be very effective in treating those people, some of them just can't deal with that much touch put onto their body. So how is the NUCA system going to be different for them?
And that's an awesome question, because a lot of the patients that we see in our office as far as fibromyalgia have tried alternative medicine, have tried massage and other chiropractic form. But again, the problem is, just like we mentioned, it's so sensitive that any touch can cause excruciating pain. Through the NUCA work, it's so gentle that they barely feel the adjustment by the time we're done. And I usually tell my patient, if I had a tomato and I was putting pressure on it, the pressure is so light that it wouldn't even leave a dent in that tomato. So that's how important our work is. But it's not just I'm just touching you just for the sake of touching you. There are so many examination and x-rays and scans to actually figure out what's going on to get to the root cause of the problem. So the touch is really realigning that top bone back into its natural proper position to allow the brain to take over. Those sensitive areas going to actually pick up the proper signal from the brain to the rest of the body to allow the body to gently and naturally heal itself over time.
You're absolutely right. So would you say that, someone getting a NUCA adjustment is probably more gentle than, say, Lance Stevenson blowing in LeBron's ear?
That was crazy. Well, let's not get into that. I stayed up late last night watching this game, and the only thing I can say, let's go Heat. Game 6 in our house. Let's close it out.
Absolutely. So, we have to address the body as a whole. And, all kidding aside, is that these people have a very real problem, and it's going on in their neck. And not to say that, getting a NUCA adjustment is going to cure their condition, but when you get the nervous system working properly, that actually decreases the stress that the body is under. So you're actually going to get normal functioning of cortisol running through your bloodstream, all normal functioning of your adrenal system, and all the endocrine organs, which, especially when someone is going through hormonal problems, the pain tends to get worse.
Yeah, and it's important to understand that we always say we don't cure anything. We don't cure any symptoms, disease. We don't cure anything. The only thing that we do is set the body in the right pathway to actually heal itself by removing interference. And I see that we got a lot of questions here. We got quite a few questions from last week. Several people asked about traumatic brain injury and migraine, and we will get to that. So stay tuned to doing the last segment, and we'll try to answer as many questions as possible. And again, after the show's over, if you have any questions, please submit those questions via our Twitter page or our Facebook page, and if we can't answer them on the air, we'll do our best to actually reply to you and answer those questions. Also, I didn't bring a book. Dr. Chung and I actually put a little book together that talks about everything, all the research that we've done with fibromyalgia and some of the things that are going on within the community. If you guys are interested in getting those books, it's free of charge. Just let us know. Call the office. We'll be more than happy to forward them to you via email.
Sounds great. So let's go ahead and take a quick commercial break. We have a great guest today. We have Noelle Zuli Adams coming on to the show. She's going to be talking about craniosacral therapy and how that could be effective. But we'll take a break for our sponsors. Make sure you take advantage of that $100 gift certificate and get a checkup in the office, either at Keystone Chiropractic if you're in West Palm or Wellington, or Upper Cervical Institute of Florida if you're in Boca, Delray, and Broward.
Are you searching for answers to your health problems? Are you looking for an alternative to harmful drugs and dangerous surgery? Have you tried everything else and figured this is just something you're going to have to live with for the rest of your life? At Upper Cervical Institute of Florida, we provide you with a safe, effective, and natural approach to restoring your health and regaining your life. Dr. Jean-Pierre will find the cause instead of masking the symptoms. Dr. Jean-Pierre utilizes the most specific techniques in detecting and correcting the vertebral subluxation. At Upper Cervical Institute of Florida, we pride ourselves in providing you with the highest standards of healthcare for you and your entire family. The procedure is gentle, effective, and affordable for everyone. Call now to schedule your free consultation. 561-409-3594. That's 561-409-6594. Or visit our website at www.uci-fl.com.
When was the last time you had your atlas checked? When your head and neck shift out of place, it can actually affect your whole body. Do you suffer from migraines, TMJ, dizziness, or chronic back and neck pain? If so, you may have an atlas problem, and you need a NUCA chiropractor. NUCA allows for a gentle and precise correction of your spine without any popping, twisting, or cracking associated with conventional manipulations. Call Keystone Chiropractic at 561-247-0044 and schedule a free consultation. Dr. Chung is one of approximately 300 doctors in the world trained in the NUCA protocol of spinal correction. Stop suffering. When your doctors can't determine the problem, you need to contact Keystone Chiropractic. We won't ask you to believe in chiropractic or commit to a lifetime of treatment. What we will do is show you what normal is, and we'll tell you how to get there again. We'll show you using precision technology that your spine has changed for the better, even after one correction. Then we'll show you the path for keeping it that way. If you are tired of constantly patching the problem and you're looking for a long-term solution that you can both feel and see for yourself, then a NUCA office is the right place for you. Once the foundation has been fixed, then we'll teach you how to keep it that way through customized recommendations designed for your spine so that the problem doesn't come back. What do you have to lose? Call today to schedule your complimentary consultation. If you call during the hour, we'll give you a $100 gift certificate to use towards your first visit. No questions asked. No commitments, just a conversation to see if we can help. 2 convenient locations in Boca Raton and West Palm Beach. Call Keystone Chiropractic today and end your days of suffering with chronic pain. Go to our website at www.keystonechiropractic.com or call us at 561-247-0044.
And we're back to the Heal Yourself radio show. From what I understand, we actually have a caller today with a question, so let's go ahead and take that question first.
Hello?
Hi.
Hi, who am I asking speaking?
My name is Polly.
Okay, that's not a caller. That's actually one of our guests that we have on the show for today. Hi, Polly. It's Dr. Jean-Pierre. How's it going?
Hi, I'm fine, and yourself?
I am wonderful. We have you here on the show with Dr. Chung and myself. So we are talking about fibromyalgia today. So I just wanted you to share with the audience some of your experience with that. How did you come about finding out that you had fibromyalgia?
It was actually after I had a car accident like a couple of years ago.
Okay.
And I was just going through like a lot of pain, and even though I was seeing a chiropractor, and I had gone to several different doctors, it just I had chronic pain. It was something that was consistent, and then I had headaches that wouldn't go away. It was just, I was really just brought down to just, okay, I have to try something. And I had to find a way to relieve the problem because it was just affecting my daily life.
Yeah, and what were some of the things that you were giving, or what were some of the things that they did for you as far as trying to get you relief?
Other than going to the chiropractor, it was like medication I was given. Even they went as far as saying, okay, you might have to take something to just, maybe it's just something you need to stimulate your mood. Maybe it's all in my head. I was told it was all in my head, and I was like, there's no way. My life was not like this. I was fine when I was younger. It was after this incident, just things got worse. So I had to find some sort of relief.
Yeah, that sounds typical. That so it sounds like you had all the experiences. You had an accident, pain and symptoms, and they gave you the drugs to mask the symptoms. And you said you were going to a chiropractor as well?
Yes, I was going to a chiropractor, but it was a temporary relief. Like, I'd go in, go to my visits, I'd be fine for like a day or so, and then it would come back. But the thing is, mine was more than just pain. It was like sensitivity in certain spots, like my neck, my shoulders. It would be what would be something small to one person, or like a short-term pain was like lasting for me.
Okay.
It was something that, let's just say I'm sorry.
No, go ahead.
Let's just say it was something that where you would bump into yourself, or someone would lightly tap you or poke you. It would be something that was ongoing for me. It was just not normal.
All right, and Polly's a patient in the office. Now tell the people what was the difference, or what was your experience in the office when you came in?
First of all, it was very inviting, and you just basically took the time to tell me, what were some things that you could possibly offer me, other than just, not only did you examine me, but you ran some tests and said, okay, this is what we can do, here's how we can proceed. You took the time to not only just inform me, but educate me about it, because I was always given the general consensus as to what fibromyalgia was.
All right. And how long when you started feeling better, and what was the adjustment like?
In reference to the adjustment, it was basically painless. I did not feel a thing. I was not in pain at all. It was effortless, you could say. And over time, like, my headaches were not as bad. And then now it's just like very rarely I get a headache. And you could say my neck and my back are, from a scale of 1 to 10, it's like a 15. It's not something, it kind of sounds skeptical. Like, you're like, okay, there's no way you could be going through all this and then medication and you go to a visit to a doctor and then now you're fine. Believe me, like, hearing something and feeling it and going through the process are two different things. You can hear someone give a testimonial or what have you, but going through as much pain as I was in and feeling the way I feel now, I wish I had known about this sooner.
Yeah, and I feel you, and that's why Dr. Chung and I are passionate about what we do, and that's why we're on the radio informing everybody that there's something out there different than traditional chiropractic, something out there better than medicine and medication and stuff like that. So tell me, how's your life different now versus before you started getting adjusted, and what are you doing these days?
Okay, well, before I had like chronic pain that affected my daily routine, work and school. Now I'm able to concentrate more. I don't have as much pain. I'm able to focus on school, and I've even started a small home-based business, but I design costume jewelry, so it's something that I was able to focus more on, do other things. I wasn't confined in my home. Now I'm more outgoing, so it's something that I'm very happy about. I would not change the experience or the referral. I should also thank my friend for referring me, because I don't know where I would be, honestly.
That is awesome, and we're gonna take another caller. But before we leave, you mentioned that you had a home-based business. Is there a contact number where people, if they're interested, can actually call you and find out more about that?
Actually, the best thing to do right now, since the site is not up, if you want to be a part of our mailing list, because the site will be up soon, you can just send your email and your contact information and the kind of jewelry you're looking for. We basically have boutique-inspired pieces, something fun, designer-inspired looks. It's basically for the fashionista who wants to keep up with the trends, but showcase a little bit of her individuality. But you can reach us at elitejewelsboutique@ymail.com. We can add you to our upcoming promotional list, so you get special discounts and find out about special events or having trunk shows as well.
Awesome, Polly. Thank you for taking the time out to talk to us, and we'll see you in the office, okay?
All right. Thank you so much. You have a wonderful day.
Have a good one.
Bye-bye.
What a great story. It's always cool to see someone get their life back like that.
Yeah, and I think that's the theme of the show. People come into NUCA offices, and literally they always say that they get their life back by getting that adjustment.
For sure. Well, we have another guest today, and we don't want our listeners to just think that, okay, this is all about NUCA, nothing else exists in the world. We actually have a special guest that I've worked with pretty closely. Her name is Noelle Julie Adams, and she is a massage therapist at the Whole Body Therapeutic Center. She does a very specific and unique type of massage therapy, and she's going to come and talk about it today. You there, Noelle?
Yes, I am.
Hi, Noelle. How are you doing?
I'm doing great. How are you guys?
We're doing very well, very well. Thanks for coming on the show today.
Oh, well, thank you so much for having me.
Well, Noelle, I know that you have a very special focus in your practice. It's called cranial sacral therapy. Why don't you take a moment to explain to our listeners a little bit about what that is?
Okay. Well, cranial sacral therapy is a light touch approach that can create dramatic improvements in your life. It releases tensions deep within the tissues in the body to relieve pain, dysfunction, and improve overall whole body health and performance.
Excellent. So what's it like? How does it work?
Well, there are certain techniques used. What you basically do is you are actually tuning into the rhythm of the system. So the nervous system has a movement to it. So as a practitioner, what you do is you use very, very light touch, actually the weight of a nickel. The body will reveal through this rhythm restrictions in the tissues. The rhythm will tell you exactly in the system if it's operating normally or abnormally. So it's kind of like how I say it's like a hydraulic system. So every time the spinal cord moves, it releases cerebrospinal fluid, which is basically our body's natural medicine for our nervous system. So as it moves, the fluid moves, and it releases to the nerves to self-correct issues in the body.
And, you know, that's one of the big reasons why I like working with you, is because we speak the same language. We're talking about CSF, and we're talking about the nervous system and how the body's self-healing. How did you stumble upon this work?
Actually, it was way back when I started doing massage therapy. They had a Florida State Massage Association meeting at the Upledger Institute, and they introduced it at that time and offered the class, and that was back in 1999, and I've been continuing the curriculum since then.
That's amazing. So we're talking about chronic pain today and fibromyalgia today. Tell us about some of your successes with treating conditions like these.
Well, with fibromyalgia, I've had a few cases. They're usually very, very sensitive when they come in, and they're so worn down by the pain, the constant pain that they have to endure all day, every day. So I like to try to create a very nice, soothing atmosphere for them, because the majority of those individuals who suffer from fibromyalgia, they're very tense. Their defensive mechanisms are really high because their nervous system is like screaming. So people that I have worked on, I would say probably about 3 months, they saw a significant reduction in their pain, to where they were able to function just like the woman, you know, that was on prior, you know, back to a normal lifestyle. The symptoms slowly dissipate, and they're actually able to do things that they hadn't done in a long time.
That's awesome. So, you know, I know this can seem a little bit esoteric to people, but what's it like to experience a session of this?
Well, it is extremely relaxing. That's what I have to say. One word is relaxing.
I can definitely testify to that.
Yes, it is so relaxing. It's like when people come in, majority of people who I work on, they all fall asleep. You can have somebody talk, and then all of a sudden they are just out. So it is just a very gentle touch, and it is just very euphoric. You know, when the cerebrospinal fluid is released through the nerves, it is just a very euphoric feeling that you get. I actually call it a floaty feeling. So when they get up, I tell them just to sit there for a few minutes, because, you know, our bodies are made to have such awesome, you know, chemicals that are supposed to be released on a regular basis. This therapy actually balances and maintains that throughout the whole entire nervous system.
Yeah, I could agree with that. And I know just in working with you and you working on me during sessions, I know I felt really light, and I just felt really at ease, and even some very stressful moments of going through a session was very relaxing for me, and I know it could definitely benefit other people. I know this could work with a wide variety of conditions, and I know that a lot of our listeners are probably anxious to try to figure out how to get a hold of you and try to schedule a session with you. So can you give us a little bit of your contact information so they could call you?
Yeah, sure, absolutely. I actually like to offer a special promotion today for anyone who's listening to the broadcast. For your first session, I would like to give 50% off. The first session is an hour and a half, which normally would be $180. So today, if you mention hearing this on the radio, I will give them a discount to, you know, $90.
That's awesome.
So my contact information, my phone number to reach me directly is 561-523-2478, or if you want to learn more about the therapy and some other therapies that I offer, you can go to my website, which is Alpha and Omega HealingCenter.com.
Awesome, Noelle. Thanks so much for coming on the show. Why don't you leave your phone number one more time, and then we'll check back in with you a little bit later on.
Okay, sounds good. It's 561-523-2478.
Awesome. Thanks, Noelle. I'll talk to you soon.
All right. Okay, thank you. Bye-bye.
Well, that was some great interviews. We're going to take a quick commercial break, so definitely give us a call and take advantage of the offers from our sponsors.
When was the last time you had your atlas checked? When your head and neck shift out of place, it can actually affect your whole body. Do you suffer from migraines, TMJ, dizziness, or chronic back and neck pain? If so, you may have an atlas problem, and you need a NUCA chiropractor. NUCA allows for a gentle and precise correction of your spine without any popping, twisting, or cracking associated with conventional manipulations. Call Keystone Chiropractic at 561-247-0044 and schedule a free consultation. Dr. Chung is one of approximately 300 doctors in the world trained in the NUCA protocol of spinal correction. Stop suffering. When your doctors can't determine the problem, you need to contact Keystone Chiropractic. We won't ask you to believe in chiropractic or commit to a lifetime of treatment. What we will do is show you what normal is, and we'll tell you how to get there again. We'll show you using precision technology that your spine has changed for the better, even after one correction. Then we'll show you the path for keeping it that way. If you are tired of constantly patching the problem and you're looking for a long-term solution that you can both feel and see for yourself, then a NUCA office is the right place for you. Once the foundation has been fixed, then we'll teach you how to keep it that way through customized recommendations designed for your spine so that the problem doesn't come back. What do you have to lose? Call today to schedule your complimentary consultation. If you call during the hour, we'll give you a $100 gift certificate to use towards your first visit. No questions asked. No commitments, just a conversation to see if we can help. 2 convenient locations in Boca Raton and West Palm Beach. Call Keystone Chiropractic today and end your days of suffering with chronic pain. Go to our website at www.keystonechiropractic.com or call us at 561-247-0044.
Are you searching for answers to your health problems? Are you looking for an alternative to harmful drugs and dangerous surgery? Have you tried everything else and figured this is just something you're going to have to live with for the rest of your life? At Upper Cervical Institute of Florida, we provide you with a safe, effective, and natural approach to restoring your health and regaining your life. Dr. Jean-Pierre will find the cause instead of masking the symptoms. Dr. Jean-Pierre utilizes the most specific techniques in detecting and correcting the vertebral subluxation. At Upper Cervical Institute of Florida, we pride ourselves in providing you with the highest standards of healthcare for you and your entire family. The procedure is gentle, effective, and affordable for everyone. Call now to schedule your free consultation. 561-409-3594. That's 561-409-6594. Or visit our website at www.uci-fl.com.
Good afternoon and welcome back to the show. And if you are sitting at home listening and wondering if this is all true, we had several people that have taken advantage of this offer. So don't wait. The show's almost over. Pick up the phone and call. Both Dr. Chung and I are offering a $100 gift card to use towards your first visit. There's no question asked. So call the office. If you're in the Palm Beach or Wellington area, call Keystone Chiropractic at 561-247-0044, or if you're in the Broward, Boca, and Delray, call Upper Cervical Institute of Florida 561-409-3594. Just like you've heard from many of our guests, your life may change by just getting that NUCA correction and get your body working properly. I know today's show is on fibromyalgia, but I had several questions here that from the last two shows that we need to get to. I have an audience member that was asking, how exactly does concussion get relief from the services that we do as far as NUCA? Does it matter if they've had multiple injuries as far as concussion?
Well, the answer to that, of course, is, if someone's had multiple concussions, then of course their brain is at greater risk of damage. So the more concussions you have, then of course the greater chance that you're going to be expressing some worse symptoms. However, it doesn't limit us from doing what we do in our office, which is the NUCA correction. And basically, it's all comes down to how the atlas shifts out of place. Just like with every other condition that we've been talking about, when the atlas shifts, then it's going to compromise blood flow, and it's going to put tension on the brain and the nervous system. So when people have this atlas subluxation and they're not getting enough blood going in and out of the brain, then it's going to start to express symptoms through chronic inflammation. It's going to start to create brain fog in certain centers of the brain where blood flow is compromised. And of course, the tension on the nervous system is going to limit the body's ability to correct itself again. So when people come in and they get these corrections, a lot of times the first thing they feel is they feel this warmth in their face, they feel a lightness, and they can actually get this feeling of brain fog. It starts to lift once they start getting their atlas corrected again.
Right, and it's important, just like we mentioned, it's impossible to really have a concussion or multiple injuries and not have a disruption of the brain and body connection. That's just literally impossible. And again, when you have concussion or multiple concussions, typically you'll get clear from the medical community, or if there's lasting problem, then you get through rehab. But what we're talking about is the after effect. Once you've been clear, a lot of patients are dealing with other effects that's happening that they can't get an answer for. That's where we come in by restoring the brain-body connection through the NUCA correction and bringing that atlas back into position, taking pressure off that brainstem. The body can actually continue the healing to allow you and your body to actually start healing and allow your body to heal itself over time.
Definitely right. And one of the other questions that I found really interesting from one of our audience members is, does your kind of work ease inflammation in the body, or does the NUCA procedure actually remove inflammation? And that's a fairly loaded question, because we don't directly address inflammation. It's all about the fact that the body actually controls the inflammatory response. A lot of people think that inflammation is this bad word and that it has to go away. And the truth of the matter is, inflammation is the first step that the body takes to heal. So if you have a sprained ankle, if you don't have inflammation to that ankle, then that ankle is going to stay in that messed up, sprained, broken state that it was, because inflammation is what gets the bad tissue out of there and starts the process of getting new tissue in there.
Yeah, and just like we talk about, the body is a self-healing, self-regulating, self-adapting mechanism. So whenever you have an injury, that's the normal response of the body to create inflammation. So, there are long-standing inflammation because the body cannot actually regulate it. So that's where we come in. Again, we don't adjust for inflammation. We really adjust to allow your body to continue the work in the process that it's doing to allow the body to heal itself. So again, when you have inflammation, sometimes that's the body's trying to clear out debris. That's the body's giving you a sign that something is going on, that you need to stay off of it. So those are positive changes within the nervous system itself.
For sure. I've taken care of a lot of people with rheumatoid arthritis and a lot of these inflammatory disorders, and yes, chronic levels of inflammation can start to go down. I've also taken care of athletes where I adjust them and all of a sudden inflammation loads up in their knee and they're trying to figure out what happened. Why did their knee get inflamed? And their knee actually needed to go through that process and clear the body of that inflammation naturally before it could actually start to heal again.
Yeah, and I guess this caller, the question was, are there different type of brain injuries that aren't considered concussion that you can help with, just as migraine? And if you listen to the show at the very beginning, our very first show was actually on migraine. Yes, and a concussion is when you get an injury or a strike or a blow to the head where the head is actually shift back and forth within the brain itself, and that can cause problem. But you may have different brain injuries that doesn't result in a concussion, or you don't black out or anything like that. But again, those things will actually eventually cause migraine, and the migraine is coming coming from the shift of the brain and the disconnection between the brain and spinal cord and all the fluids and everything not draining properly, resulting into migraine. How do we help from that? Again, if you heard my story with migraines, by gently adjusting that C1 vertebra and bringing it back to proper position, the body is able to release the tension to allow the migraine and everything to actually get better. So yes, that's what we do.
And, brain injury just isn't isolated to migraines or concussions. Brain injury can happen in strokes too. And the truth of the matter is, stroke is just a matter of blood not getting to the brain properly. So, I've taken care of a lot of post-stroke recovery patients that use NUCA to restore their self-healing capacity, in addition to the occupational therapy and the physical therapy that they have to go through in order to get their function back.
And one of the things I want to be careful and want to warn people is it almost sounds like what we do in the office is a cure-all for everything. This is the magic potion or the lotion or whatever. But the truth of the matter is, all we do in the office is one thing. We don't fix concussions or fix migraine or what we're talking about, fibromyalgia. We don't take care of any of that. What we're talking about is restoring the brain-body connection to allow the body to do exactly what it was designed to do. When we opened the show, we talked about the body's being a self-healing mechanism, and all it needs is the catalyst to actually do what it's supposed to do. That's what we do. That's where we come in. When you have an accident, injury, or fall, this connection between brain and body takes place. So all we're doing is restoring that and stepping aside to allow the body to do what it was designed to do, which is to heal itself. And 90% of the time in our office, it actually does exactly that.
Yeah, and the truth of the matter is, as great a doctor as Dr. JP is, and as great a doctor as I am, the truth is the best doctor in the world sits in every single one of our listeners already.
That's it.
It's just a matter if that doctor is working properly, and the only way we could tell if that doctor is working properly is if their nervous system is working to its full capacity.
Yeah, so when you come into our office, it's not just we're just going to look at you and give you an adjustment. There are a series of things that we're going to do to actually figure out whether you're a candidate for our care and to figure out whether this is something that's going to work for you. So again, the process is long, and I don't mean to make it sound simple because it's not. So again, take advantage of the offer that we're doing. When you come in, you'll be amazed about the specificity of the work and how difficult it really is. But our passion is what drives us. Like I said, my story, my life was drastically changed by this, as many of our patients. So when you come in as a patient, we want to really take care of you, but take care of your entire body as a whole, and not just the symptoms of the pain. So again, call Ariel and Brittany standing by. Call and take advantage of the offer, and maybe one of these days we'll be talking to you on the radio.
Awesome, JP. Well, it's been a fun show today. I've really enjoyed talking about fibromyalgia and all their success stories with people with chronic pain. What do we got on the docket for next week?
Well, this is a good topic. I've seen a lot of patients with that, and there's been tons of research being done on the NUCA work and this specific condition, and a lot of people around have suffered from this, and it's high blood pressure. Interestingly enough, a couple of years ago, the normal high blood pressure was 120/80, but now normal blood pressure is 110/70. So if you have a blood pressure of 120/80, guess what? You pre-hypertension and you're on the medication. So tune in next time as we discuss how NUCA can drastically reduce high blood pressure and allow your body to heal itself without the use of drugs or medication.
Awesome, JP. I'll see you next week.
Have a good one.
Join Dr. Jonathan Chung and Dr. Greg Jean-Pierre each week on the Heal Yourself radio show every Thursday at 5 p.m. Listen each week as they interview leading health experts to provide you with comprehensive and natural solutions to make your body work at its best and solve chronic health problems. Right here on 1470 AM, the Health and Wealth Network. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors.